guys, Coach Marissa here from Fortune Practice Management of Nebraska, and today I'm doing part 2 of treatment enrollment. So Chris did part 1, which was the clinical piece, which is obviously very important, and I'm going to talk about the front office's piece today. What we find is there's usually 3 things that might be kind of the culprit if patients don't accept treatment. One can be the pass to the doctor, so that communication that Chris talked about, kind of setting the doctor up. The other one is the pass to the front office. So talking about the clinical exam and then obviously the front office's piece after it's been passed. So why we call it the ball of power is we know that the doctor has that power that Chris alluded to, and also, the reason why we call it the ball is because in any of these places, the ball can be dropped, right? So us really looking at if we have dropped the ball, where are we dropping the ball? And how do we get these patients to the care that they need? This is not about the money, right? This is all about where are we bleeding patients out that need dentistry done. Dentistry does not go out in the world and get any better. So we're doing these people a favor by having them figure out a way to get this treatment done, get it done fast, and be able to afford it and to have it fit into their lifestyle. So those are the pieces that we look at when we do treatment acceptance. Unfortunately, the national average for treatment acceptance for patients of record is less than 50%. And for new patients, it's less than 28%. That's staggering. Really, the way that we look at it is 50% of your patients that come into your practice are your sweethearts. They will do anything you ask them to do if you just ask them to do it. And we're nationally not even getting those people, which means we're not asking in the way and educating them in the way that they need and communicating the right way. So that's the first piece. The other piece is new patients being so low is because they don't know you yet. So they don't trust you. Even if their aunt or sister or husband recommended them to come to you, they don't know you or trust you. So what are we doing to communicate to these people in a way that they can really be comfortable? Because what we know about people is when they're comfortable, they buy. And what they're buying in this case is their health. That's the beauty of what we do for our sales, right? I know no one in the dental field loves that word, and we totally get that. But we are selling. We're just selling health. What a beautiful thing to sell, right? So how are we going to get these people more healthy? So we look at all those kind of balls that we can drop. And one of the things that I look at most often is the front office and what can we be doing better? So picking up where Chris left off, what I would say is that as you are walking your patient forward, let them know where they're going, please. It's really super weird if they show up in a consult room and they had no idea where they were going and they thought they were free, right? What we know is as soon as that bib comes off, they smell freedom. So please let them know where they're going so that that poor front office person isn't stuck with a patient that's like, I gotta get out of here. Why am I in this room with you? So that would look like, Joyce, I'm gonna go ahead and walk you forward. I'm gonna put you in our consult room so that Marissa can go over your finances with you. Perfect. Again, communication equals comfort, and comfort equals I'm gonna buy my health. So walking that patient up, we realize a lot of offices do not have the luxury of a beautiful consult room anywhere private. We have offices that do it in the operatory if it's over a certain amount. We realize that sometimes you gotta turn those over pretty quickly, and that is prime real estate. So if you don't have that luxury, we have some that do it kind of in a more away from the reception area, private area. We have offices that have converted some of their walk-in closets to a really nice, private, clean area that someone can come and sit. Please just think outside the box. There's ways to do this and have people feel private, because if I am not comfortable telling you I can't afford $500, I'm sure as heck not going to schedule, or I'll schedule and I'm gonna fall right off the books. So please let them know where they're going. Please have a private place for them to go. And really let them know that they're comfortable by communicating to them. The other piece is please, clinical team, do the pass that Chris talked about and get the heck out of Dodge, please. When you hover, it is super awkward for our front office, because now the clinical person that has told them what they need is hovering over them. Do you think they're going to be honest with me about not being able to afford treatment, or that they're not going to schedule it. No, they're going to get on my books because that person's standing there and they just spent an hour explaining how important it is to them, and they're going to fall off. Either they're going to cancel or they're going to no-show. That's what we typically see happen. So please do a beautiful pass and then exit, and we've got it from there. Now, front office. Many, many moons have I spent in treatment plans. I was a treatment coordinator for a long time, office manager, front office, you name it. And I kind of sucked at it for a long time. And most of that is because I wasn't comfortable with the money. I was a single mom at the time, and $500 may as well have been $5 million to me. So I just would sometimes not say the numbers or just get them to sign it really quick so that I didn't have to worry about dealing with the fact that they couldn't afford it. So I think one of the biggest pieces here is get comfortable with the money. Know that they are investing in their health. That's the way I got over it. I knew that if I could get them healthy, they would be living a better life. And so I would want someone to sit with me, knowing I couldn't pay that at the time, and figure out how I could pay it. So that's really what I did, is I was just the person that I would want someone to be for me. So once you have that person sitting down there, what you have in front of you is an opportunity to really, truly get them financially arranged. The way I look at researching insurance benefits before a treatment plan, if they have insurance benefits, is the exact way that I look at someone taking x-rays before an exam. I cannot give them a full diagnosis of what I think their insurance will help with if I do not have a good picture, right? So I do have offices that don't look up insurances ahead of time, and when we start working with them, that's one of the first priorities. Please do the research ahead of time so that when you sit in front of that person, you are the authority of how they're going to get paid. Now, obviously, we don't know what insurance is going to do. I do not have a crystal ball. If I had that, I would send it to all of you free of charge just so you had that information. But what we can do is be the concierge of their insurance for them. Long gone are the days where we say, your insurance is your benefit and you have to be in charge of researching that. There are a million other people out there that will be happy to research that patient's insurance for them and be their concierge. So you got to step up to the plate. It is 2020, right? So that's number one. Number two, if I'm well versed and I know their insurance and I'm sitting down with a plan for them, this is the verbiage. I'm telling you, this works. I've done it a million ways. I've failed even more than a million ways. And this has been the best. And it's very super simple. And it looks like this. Joyce, it looks like the total investment for your treatment is $1,000. What we're expecting for your insurance to help with is about $500 of that. So that leaves your estimated patient portion at $500. What questions do you have for me? Zip it. Let them sit in silence and really process. What we tend to do when we're uncomfortable with the dollars, I used to do this, is fill that void, right? We fill that space with information. Oh, or I can do half today and half tomorrow, half at prep, half at seat. You know, we start giving them all the tools in our toolbox, if you will. Don't hand them any tools that they don't need. If you give me an option to give you payments of $25 every day for the rest of my life, you bet I'm going to do that. Ask them what questions they have and listen. Typically, the question you're going to get is, well, do you guys take payment plans? My answer is always this: absolutely. What did you have in mind? I know that seems silly, especially if you don't take payment plans, but what we need to figure out is, what do they have in mind? Their payment plan might be, well, out of that $500, I can give you $250 today and $250 at the prep. Well, why would I split it up any differently? That's beautiful. Their payment plan might also be, I'd like to give you a penny every day for the rest of my life, in which I would reply, whatever third party that I have you ever heard of Care Credit, right? Because we're not a bank and we're not a nonprofit, you guys. So please, please ask them questions to get more clarity. I want them to tell me how they're going to pay. Then they feel in charge. They feel comfortable. They're going to get scheduled, right? So we want them to kind of be the keeper of how this is going. And I only give them a tool every time they ask me another question. Do you guys take payments? Absolutely. What did you have in mind? I can only do $25 a month. Okay, well, I have an awesome company that we work with called Care Credit, and they can do up to 12 months interest free or whatever you guys would offer. It's really important that you only give tools as they need them. Otherwise, we're giving them tools that they may not need. So this is them being in charge, and then they're gonna feel really well taken care of because you helped and took time to help them get fully financially arranged. Next piece of that, handwrite it on that treatment plan of how they're gonna pay, flip it over, have them sign it, scan it in, put it in the doc center so that if another front office person is checking out, they can simply pull it up and see, oh, Joyce said she was gonna pay $250 today. She already paid her first $250 when Marissa went over her treatment plan. I got this. Joyce, it looks like you owe $250 today. That's it. I think that us really just simplifying it, listening, realizing that the importance of a treatment plan is not just to get a signature, so we went over it with them. It's also not to read an entire list of things that is kind of a dissertation on how their insurance might not pay. We don't need to go crazy here. Make it simple, let them know what their estimated patient portion is. If they have questions like, is my insurance gonna pay all that? You know what, Joyce, that is a wonderful question. We never know exactly what insurance is gonna do, which is why we call it an estimate, but we do the very best we can to get all the information based on what your insurance can do. If they pay more, we'll get you a credit back. If they pay less, then obviously we'll send you a bill, but we do our very best to fight for you to get it paid as well as we can. So I hope this helped. If you guys have any questions at all, please feel free to reach out. I know this can be kind of a funky situation based on your specific office. So if you have any specific questions on how can we plan this for our office and really make it the best system possible, we'd be happy to help. Thank you so much. Have a great day.